Good afternoon, everyone, and thank you for joining us live today. My name is Ebony Caldwell, and I am the System Director for Diversity, Equity, and Inclusion at Rochester Regional Health. And I'm joined today by Dr. Elizabeth Lee, a cardiologist at Rochester Regional. April is Sarcoidosis Awareness Month, and we wanted to get together to discuss the disease, how it's treated, the disparities in risk among, and the disparities in risk among different racial and ethnic groups. During our discussion today, please feel free to use the chat feature to ask questions. So let's get started. Sarcoidosis is not a disease that is commonly discussed. So can you tell us a little bit about what sarcoidosis is?
Yeah, absolutely. It's a relatively rare disease, which may be why people aren't as aware about it, but definitely an important disease to be get more education about. The incidence in the United States is less than 1%, actually about 0.01%. So like I said, it's relatively rare. What it is it's a autoimmune disease, which means that the body starts to attack itself, and it can affect any organ system, really. Most commonly, the lungs. About 95% of cases are in the lungs, but you can also have skin involvement of the heart, which is where my practice expertise comes in. You can have involvement of the liver. So really, it could be a total body disease. And what we look for is characteristic inflammation under the microscope. So to make the true diagnosis, you really need a tissue sample, so a biopsy from somewhere, and the pathologists look for a classic characteristic inflammation pattern under the microscope, and that's how we make the ultimate diagnosis.
Thank you, Dr. Lee. So you've made it clear what the doctor is looking for, but what should we as patients look for? What are the signs and symptoms of sarcoidosis?
Right, absolutely. So, like I said, it's most commonly affecting the lungs. So you may feel shortness of breath or difficulty breathing. Some patients may initially think that they have asthma, and that might bring them to seek additional information or care from their doctor. But like I said, it can be a total body disease. So you could get skin rashes from this. Sometimes they're kind of bumpy, like nodules on the skin. You could get eye inflammation from this disease, usually a really red and painful swollen eye. You can get heart involvement, and that usually would be abnormal heart rhythms. It can also cause heart failure, meaning weakness of the heart muscle. So that may bring a patient to seek additional care from a cardiologist like myself. And then, sometimes we do find involvement of the liver, but usually that doesn't have symptoms. We find that if we're kind of looking under a ultrasound, if we have a suspicion of sarcoidosis elsewhere.
Okay. And can you tell us why African Americans are at greater risk for contracting this disease, and what are the risk factors associated with this disparity?
Right. So unfortunately, we don't know a lot about what causes a person to get sarcoidosis. It's an area of active ongoing research right now. There have been suggestions that there's a genetic underpinning for this disease. So perhaps there's a genetic predisposition, and African American race is a marker of that genetic underpinning, but we just don't quite understand that risk yet. And then what we suspect is this genetic predisposition then is triggered by an environmental trigger. So perhaps that's an allergen in the air, like a pollen or something like that. Perhaps it's a virus that a patient gets and they may not even know that they were sick at all. Perhaps there's another exposure at a patient's workplace. There have been suggestions that workplace exposures could trigger this disease. So we're not exactly sure what causes this, but definitely what we do know is that African Americans are at a 2 to 3 times higher risk of contracting this disease compared to white Americans. So there definitely does seem to be a predisposition, like I said, probably something in the genetic makeup that is associated with African American race, but we just don't quite understand. And then unfortunately, there are a lot of social determinants of health to consider that are more prevalent in African American communities. because of racial disparities that have been ongoing over the course of time. So it may be that in African American communities, running into some of these environmental triggers is more common, because of the neighborhood where historically African Americans live, or perhaps because of work environments, which are more commonly jobs that are more commonly held by African Americans. So, certainly something to really be aware of. But it's just so complicated when we talk about these disparities in health that are related to socioeconomics and race. So it's a pretty complicated interaction.
Thank you. And so it seems to be a thread in a lot of the awareness months that there is that element of health equity we need to think about and social determinants of health.
Yes.
I'm sorry, are you saying something?
That's absolutely right.
Okay.
Yeah.
And so knowing this, and we know that there's a lot more to learn about this disease, do you know, or can you share with us some differences in treatments based on culture or other factors?
Right. So, the main treatment for this disease, wherever it's affecting, whether it's the heart or the lungs or other areas of the body, is immunosuppression. Usually our immunosuppression regimen is prednisone, which is a steroid. Then oftentimes, particularly in my practice, if the heart is involved, I'm trying to get people off of steroids as much as possible, as quickly as is safe, because there are a lot of risks associated with high doses of steroid use, including weight gain. It can make high blood pressure worse, it can make diabetes worse, and it can thin your bones. So we really are aware of that. And, it's tailored to the patient a lot of the times, because if a patient already has risk factors like those I mentioned, like they already have diabetes, they already have high blood pressure, and the prednisone may make that worse, we may choose a more escalating or more faster treatment course of trying to get off of prednisone or other steroids and onto some of these, we call them steroid-sparing agents, which are non-steroid immunosuppression regimens. So not necessarily tailored to a person's race or ethnic background, but definitely tailored to their underlying health issues that they already may have.
Great, thank you. So if you're just joining us, welcome. My name is Ebony Caldwell, and I am the System Director for Diversity, Equity, and Inclusion at Rochester Regional. And I'm joined today by Dr. Elizabeth Lee, who is a cardiologist at Rochester Regional. And so we're going to jump back in with a few more questions. What is Rochester Regional Health doing to better understand and combat this disease?
Right, absolutely. So, we know in the community where we serve, there may be a higher risk patient population for sarcoidosis. So on the cardiology side of things, we are really actively looking for that in our patient populations. We do a lot of special imaging tests. So cardiac PET, which can look for inflammation in the heart, and also cardiac MRI, which can look for inflammation and scar in the heart as well. So we're using those imaging modalities, which are really pretty specific and specialized, and we have a really active program for both of those modalities here at Rochester Regional Health. So we are using those to try to identify our patients if they have heart involvement, and then treat them appropriately. We also work really collaboratively with our partners in pulmonology. So they may see a patient who has sarcoid involvement in the lungs, which is, like I said, is the most common place to get sarcoid inflammation. And if they identify a patient that has risk factors in terms of their heart, then we work collaboratively with them to get those patients seen in our clinic, so that we can identify if there's any heart involvement going on and help to manage their treatment regimen in that way.
Great. And for those watching in the community, is there anything individuals can do to prevent sarcoidosis?
So that's hard because we don't really understand exactly what triggers this. I think just being mindful of any symptoms that you may have, particularly lung symptoms, and bringing those to the attention of your primary care doctor so that we can potentially identify sarcoidosis if that is an issue for you. And then, just being proactive about your health and continuing to cultivate those relationships. As long as we're talking about disparities, we do know that depending on a person's socioeconomic group or racial group, they may not have as good of a relationship with a primary care doctor as maybe we would hope, or they may not have access to care. They may live by a doctor, but they may not be able to take time off work or otherwise access their health care. So, I think just trying to be your own advocate for your health is really important, and try to cultivate a relationship with a primary care doctor. So if anything does come up, that you have somebody to go to seek out extra help.
Great. And so overall wellness and proactive care is something that we should be focusing on.
That's right. Absolutely. And that will help, sarcoidosis or anything else, it's always total body care is really important.
Right. And so our final question is there anything else you would like to mention about this disease and what we should be thinking about as we learn more?
Yeah, so, I think it's definitely an area where hopefully we'll gain more knowledge moving into the future, and we'll be able to help our patients better who do have this disease and are living with it. So, we're working to hopefully have some research involvement opportunities for our patients. We are involved in some registry research, where we would pool data from our patients and other patients throughout the country to try and gain a better understanding of this disease. So, we are actively thinking about this and trying to help move some information forward so that we can discover more about this important disease and help our patients into the future.
Great. So I want to thank you for joining us today. Thank you, Dr. Lee, for taking the time out of your schedule to talk to us about sarcoidosis. And again, if you're watching, feel free to leave us questions in the comments section and visit our website for more information. Thank you, everyone, for joining.
Thank you very much. Have a great day, everybody.